8 signs your kidneys are crying for help. If you have ever paid attention to any of your visits to the doctor, you'll know that every doctor asks you a bunch of questions about your health, takes your medical history, and looks for obvious physical signs of disease using their observational skills. Sometimes we also know when it's time to pay a visit to the hospital when, let's say, we can't stop coughing, or when we do, we cough up blood. Now that's not normal. And we know enough to understand that it means that our lungs are not doing okay. When we notice blood in our urine, we immediately know that that's not supposed to happen. So we believe our kidneys are in trouble. Now, we're not claiming that you can diagnose a disease just like a professional physician can, but if you pay close attention to what your body tells you, you'll see that besides blood in urine, there are many other signs that you should take into account when you doubt that your kidneys are not working properly. And that is why we're here to help you understand 8 signs that your body shows when it tries to tell you that your kidneys are crying for help. But first, let's talk about the organ itself. The kidneys come in a pair, are shaped like a bean, and are present at the back on either side of our spine, with the left kidney a little higher than the right one, because the liver is also present just beneath it and takes up more space. They're part of the urinary system and also offer a prime position for the adrenal glands, which are present on top of each kidney. These powerful pair of organs are responsible for getting rid of the toxic waste that is present in the blood, as they filter blood free from all possible waste products and get rid of them in the form of urine. They also help maintain the body's balance of water and electrolytes, so that all the body functions are performed in the best way possible. So what can happen when one or both kidneys stop working properly? Now that we just told you how important they are, you can imagine that the answer to that is a couple of things. But let's talk about kidneys losing 90% of their ability to function, which is a condition called kidney failure. If you don't get your kidney replaced or use dialysis treatment, your life can end. The saddest part about all this is that more than 1 in 7 US adults have chronic kidney disease, or KCD, and it is slightly more common in women than it is in men. More than 800,000 Americans are living with end-stage kidney disease, or ESKD, and that is 1.6 times more common in men than it is in women. The point here is that any of us could have kidney problems that can worsen over a couple of days to become fatal. So when our kidneys are crying for help, we need to listen. And that's what we're going to do. We're going to help you notice 8 signs that your kidneys might be in trouble. So let's get started. Number 8. Breathlessness. We bet that you didn't expect to feel out of breath in our list of warning signs to watch out for regarding kidney health. Because most of us think that if we are unable to breathe properly and easily, then that means that we have some kind of respiratory infection, or that we have asthma. While all these could be true as well, sometimes the underlying reason should be considered before jumping to any conclusions. When our kidneys don't filter out fluids properly, our lungs can get filled up with these excess fluids, and that can make breathing difficult. So having trouble breathing could be a sign that our kidneys aren't working properly. Number 7. Swollen hands and feet. This one is an obvious sign if you know what you're looking for. It's the job of the kidneys to get excess fluid out of the body so that water and electrolytes are maintained in a good balance inside the body. But if your kidneys aren't working right, they will retain sodium inside the body, which will make water stay inside the body as well. And as a result, it will start to accumulate in other areas of the body, such as your hands, legs, and feet, making them swell up, and you'll feel bloated. And this should be taken as a sign that you need to get your kidneys checked. Number 6. Puffy eyes. Have you ever washed your face after a good crying session, or after sneezing uncontrollably because of pollen? If you answered yes, you probably remember swollen or puffy eyes that take a while to get normal. Our eyes reabsorb tears and make them puffy, but that's not what happens when our kidneys are in trouble. When our kidneys are unable to keep a check on how much protein is lost through urine, we lost a little too much of it, and this can make the eyes get puffy. In fact, in the case of nephrotic syndrome, people often suffer from proteinuria, where unusual amounts of protein are lost via urine, and puffy eyes are one of the leading symptoms. Number 5. Loss of appetite. In case you ever feel like skipping meals, or don't feel like eating at all, even if you have had nothing since morning, maybe you need to rethink your decision of not wanting to eat. Let us help you understand by breaking down the science behind this in simple words. Hormones leptin and acylated ghrelin help regulate food intake by signaling the brain about the body's nutritional needs. Leptin suppresses the intake of food, whereas ghrelin helps in meal initiation. In research conducted about the chronic kidney disease or CKD patients, it was found that significantly high leptin levels and low levels of ghrelin were found in patients with chronic kidney disease, which helps us understand why losing your appetite might point towards a more serious problem. Number 4. Sleeplessness. Having trouble falling asleep? It could be because something is bothering you, or because you spend too much time scrolling on social media before sleeping. But it could also mean that your kidneys aren't okay. Many studies have linked poor quality sleep with increased likeliness of chronic kidney disease or CKD, one of which highlighted that in US adults, a shorter sleep duration was connected to a lower estimated glomerular filtration rate, or EGFR, which is a measure of how well the kidneys are working. Who would have thought that being unable to sleep means your kidneys are keeping you up? But here we are, trying to warn you about the subtle sign. Number 3. Fatigue. Feeling tired? You could think it's because you worked out a lot recently, or because you are physically or emotionally exhausted. But what you should think is that whether this is your body trying to tell you to get your kidneys checked. Everybody feels tired now and then, but if you feel so tired that your body seems to weigh you down and prevent you from working on routine tasks, then it is experiencing fatigue, which has been shown in many studies as a classic sign of end-stage renal disease, or ESRD. Number 2. Nausea. If you feel like throwing up and experiencing nausea, this might be a sign that your kidneys aren't working like they're supposed to. People add more water and fiber to their diet to get rid of nausea. But the truth is that when our kidneys don't get rid of toxic molecules from our blood properly and fast enough, they can build up inside our blood and cause many problems, such as nausea. Some people also complain about having bad breath, even though they take good care of their oral hygiene. Well, if your bad breath doesn't go away, maybe it's time to get your kidneys checked. Number 1. Problems with urination. We saved the most important but often overlooked one for the last. You might feel the need to urinate too much, or too little, or have blood in your urine, or it may have a weird color. If your urine is pale yellow, it is normal, and that means your kidneys are okay. But if it is dark yellow, red, or greenish, that means that there's something wrong with your kidneys, and you need to go to a doctor. Some medicines and some diseases can also affect the color of your urine. But whatever it is being filtered by your kidneys, so that means they are involved as well. That was all about how different signs can be warning signs about your kidneys if you pay close attention. But what can you do on your own to take care of your kidneys? Well, one way is to make sure you drink enough water and limit your use of medicines. When we say limit your medicines, we're talking about people who like to self-medicate a lot. Another way to help your kidneys is by making sure your blood glucose levels aren't too high, because high blood glucose levels can cause kidney damage. Quitting smoking and limiting alcohol consumption are also good options to make sure you're not stressing out your kidneys. Even though all these are good ideas that can help lessen the damage done to the kidneys, whenever you find your body exhibiting any of the signs that we just mentioned, remember to go to a doctor and get properly checked. Being safe is always better than being sorry. And with that, we conclude our list of warning signs and hope to see you soon with more interesting videos regarding your health and well-being.